A patient suddenly becomes unresponsive while you're assisting them with ambulation. What is your first response as a patient care technician? A. Start CPR immediately. B. Call for help and check for responsiveness and breathing. C. Check the patient's blood pressure. D. Leave the patient to notify the nurse. Answer: B. According to BLS protocol, the first step is to assess responsiveness and breathing. CPR follows only if the patient is unresponsive and not breathing. A diabetic patient scheduled for a fingerstick glucose test refuses the procedure. What should you do next? A. Perform the test anyway. B. Notify the nurse about the refusal. C. Record the result as 0. D. Mark the patient as non-compliant and move on. Answer: B. Patients have the right to refuse treatment. Always report refusals to the nurse or provider for documentation and follow-up. While collecting a 24-hour urine specimen, you notice the patient discarded one of the samples. What should you do? A. Continue collecting. B. Inform the lab. C. Start the collection over and notify the nurse. D. Label the container incomplete. Answer: C. If any part of the 24-hour sample is lost, the entire test must be restarted. Notify the nurse to get new instructions. Which of the following would be an abnormal finding during post-mortem care? A. Lack of pulse. B. Rigor mortis. C. Cool skin. D. Bright red bleeding from the mouth. Answer: D. Active bleeding post-mortem is abnormal and may indicate trauma or require further investigation. You are assigned to monitor a patient on seizure precautions. What items should be kept at the bedside? A. Restraints. B. Suction equipment. C. Heating pad. D. Alcohol wipes. Answer: B. Suction equipment is vital to maintain airway patency during or after a seizure if secretions obstruct breathing. While assisting with a sterile dressing change, you accidentally touch the inside of the sterile dressing tray. What should you do? A. Ignore it and continue. B. Replace the contaminated item and notify the nurse. C. Finish the procedure quickly. D. Only touch sterile items with gloves. Answer: B. Sterility must be maintained. Contaminated supplies must be replaced immediately to prevent infection. Which of the following lab results would you report immediately for a patient on dialysis? A. Sodium, 138 milliequivalent/L. B. Potassium, 6.2 milliequivalent/L. C. Hemoglobin, 12G/dl. D. Calcium, 9.1 milligrams per deciliter. Answer: B. A potassium level above 6.0 milliequivalent/L is critical and can cause cardiac arrhythmias, especially in dialysis patients. A PCT is asked to obtain a blood pressure reading on a patient receiving a right-sided mastectomy. What is the correct action? A. Use the right arm. B. Use either arm. C. Use the left arm. D. Use the thigh for measurement. Answer: C. Blood pressure should never be taken on the side of a mastectomy due to risk of lymphedema. What is the most accurate site to measure core body temperature in an unconscious patient? A. Tympanic. B. Oral. C. Axillary. D. Rectal. Answer: D. Rectal temperature reflects core body temperature most accurately, especially in unconscious patients. What is the appropriate angle for inserting a needle during a venipuncture on the antecubital fossa? A. 15 to 30 degrees. B. 45 degrees. C. 60 degrees. D. 5 degrees. Answer A. For venipuncture, a 15 to 30 degrees angle ensures proper vein access without going too deep. While assisting with perineal care for a female patient, the PCT should clean A. From back to front. B. In circular motion from outside in. C. From front to back. D. Only the perineum. Answer C. Cleaning front to back prevents introducing fecal bacteria into the urethra or vaginal area. A patient suddenly begins choking while eating. The patient is conscious but unable to speak. What is the correct action? A. Perform abdominal thrusts, Heimlich maneuver. B. Ask them to drink water. C. Encourage them to keep coughing. D. Check their pulse. Answer A. Abdominal thrusts are required for conscious patients with complete airway obstruction. You notice bruises on both upper arms of an elderly patient. What is the most appropriate action? A. Ignore it since the patient is old. B. Report your observation to the nurse immediately. C. Ask the family if they caused it. D. Cover it with clothing. Answer B. Unusual bruising may indicate abuse and must be reported immediately to the licensed nurse. Which of the following best describes orthostatic hypotension? A. High blood pressure at night. B. Low blood pressure after standing. C. Sudden chest pain. D. Increased heart rate after eating. Answer B. Orthostatic hypotension is a drop in BP when moving from lying to standing, leading to dizziness or fainting. A PCT is assigned to collect a sputum sample. What instruction should be given to the patient? A. Drink water and urinate first. B. Rinse mouth with mouthwash. C. Take deep breaths and cough deeply into the container. D. Use a cotton swab on the tongue. Answer C. Deep cough helps bring sputum from the lungs rather than saliva. When documenting care in a patient's record, which principle should the PCT follow? A. Use whiteout for corrections. B. Document care before providing it. C. Use exact time and objective information. D. Avoid documenting if in a rush. Answer C. Documentation must be factual, objective, and timely for legal and clinical accuracy. A PCT is preparing to lift a patient from bed. Which body mechanics principle should they apply? A. Keep feet together. B. Lift with your back muscles. C. Bend at the waist. D. Use your legs and keep back straight. Answer D. Safe lifting involves bending at the knees, using legs, and keeping the back straight. You're asked to obtain a stool sample from a patient with suspected C. difficile. What precaution must be used? A. Standard only. B. Droplet precautions. C. Contact precautions with hand washing using soap and water. D. Airborne precautions. Answer C. C. Difficile spores resist alcohol. Hand washing and contact precautions are necessary. During hemodialysis, you observe blood leaking at the fistula site. What should you do first? A. Document it. B. Call the family. C. Apply pressure and call the nurse. D. Wipe it and recheck later. Answer C. Bleeding at the fistula site can lead to severe blood loss. Immediate pressure and nurse notification are critical. A patient in restraints asks to use the restroom. What is the best response? A. Say no to prevent injury. B. Ignore until the next round. C. Remove the restraints one at a time and assist. D. Loosen the restraints slightly. Answer: C. Patients in restraints still have rights. Assist them safely and with supervision. Which of the following foods should be avoided for a patient on a low-potassium diet? A. White rice. B. Banana. C. Apple juice. D. Boiled chicken. Answer: B. Bananas are high in potassium and should be avoided on potassium-restricted diets. A PCT is assigned to perform post-op vitals every 15 minutes. After 10 minutes, the patient is pale and hypotensive. What should you do? A. Finish the 15-minute wait. B. Reposition them. C. Report the change immediately to the nurse. D. Give them water. Answer: C. Sudden hypotension and pallor post-op may indicate bleeding or shock, requiring immediate attention. Which of the following requires airborne precautions? A. MRSA. B. Tuberculosis, TB. C. Hepatitis B. D. C. Difficile. Answer: B. TB spreads through airborne particles, a negative pressure room and N95 are needed. When collecting a midstream clean catch urine sample, which instruction is correct? A. Urinate fully into the container. B. Wipe front to back, urinate a little, then collect midstream. C. Collect urine from the toilet. D. Drink juice before collecting. Answer: B. A clean catch helps prevent contamination of the sample with external bacteria. A dialysis patient's AV fistula is swollen and red. What should you do? A. Ignore and continue. B. Apply an ice pack. C. Report signs of infection to the nurse immediately. D. Elevate the arm only. Answer: C. Redness and swelling may indicate infection, which is a serious complication in dialysis patients. The most accurate method to measure fluid intake is: A. Estimate from the glass size. B. Ask the patient. C. Use a graduated container. D. Assume based on time. Answer: C. Measuring with a calibrated container ensures exact fluid documentation. A confused patient keeps removing their nasal cannula. What is the best approach? A. Use restraints. B. Re-educate and monitor frequently. C. Ignore the behavior. D. Increase oxygen flow. Answer: B. Reassuring and reminding the patient frequently is more ethical than restraint use. When should a PCT wash their hands during patient care? A. Before meals. B. After using the bathroom. C. Before and after each patient contact. D. Only at the start of shift. Answer: C. Frequent hand hygiene prevents infection transmission in healthcare settings. What should be done first when assisting with a bed bath? A. Clean perineal area. B. Wash face without soap. C. Apply lotion. D. Change linens. Answer: B. Start with the face using water only to avoid irritation. A patient tells you they're in severe pain during ambulation. Your correct response is to: A. Encourage them to keep walking. B. Give them a back rub. C. Assist them to a chair and notify the nurse immediately. D. Tell them pain is normal. Answer: C. Pain during ambulation may indicate injury or complication and must be evaluated.